Hello, this is Dr. Feast Price, and I'd like to provide you with an overview of the course Mental Health Diagnosis and Treatment. In so doing, I will provide a brief welcome, an introduction of myself, our teaching assistant, and our guest lecturers. I will also provide in-depth information regarding our course syllabus as well as the course requirements for this course. So in welcoming each of you, I'd like to say that I'm delighted that you have selected this course to take. I thoroughly enjoyed developing it and planning it. And as I've worked on the syllabus, I developed it from the context of what I believe to be most important in the field of mental health treatment provisions for persons with various forms of mental illness. So I'd like to welcome each of you. I hope you find the course rewarding. I hope that you take the assignments seriously and you work hard to get the most that this course has available for you, because I am certain that everything that is in this course will be of use and value to you in your profession of choice, whether it be working as a mental health practitioner or meeting the needs of persons with various forms of mental illnesses. I'm sure you'll find that this information is very important. And because we work with a lot of treatment teams, oftentimes you might find yourself in the position of serving on a treatment team. And as such, you will find great value and benefit to having had this background, because it allows you to have an informed conversation with other professionals that are providing services to persons with mental illness. So again, welcome to the course. I'm delighted that you're a part of this experience, and I feel certain that if you do your part, you're in for a wonderful end result. Just to tell you a little bit about who I am, I'm Dr. Feast Price, Sanja Feast Price, and I have been on faculty here at UK for 20 years. I'm a professor in the graduate program in rehabilitation counseling, which is in the Department of Special Education and Rehabilitation Counseling. I provide training to students in theories and techniques of counseling too. I also teach the group therapy and family therapy course. It's the group and family therapy course. I work with students in practicum and internship experiences. And I also teach courses that might be independent studies that allow students to expand their knowledge base with regard to persons with mental illness. In terms of my professional background, I am a licensed counseling psychologist. I've been licensed as a psychologist since December of last year. And in addition to being a licensed psychologist, I'm also a licensed professional clinical counselor. So my educational background is in the areas of rehabilitation counseling and administration, as I hold a doctorate degree in rehabilitation research and administration that was completed in 1992. And then in 2006, I completed my PhD in counseling psychology. I have a strong love for working with persons with mental illnesses of various kinds. I also like working with persons that are adjusting to various forms of life-altering experiences. So whether it be disability-related, transitions from school to work, transitions from being married to divorce, or from single parent to a blended family, I enjoy working with persons that are experiencing various forms of adjustment issues. I have a small private practice where I provide individual, group, and family therapy. I work with persons that are nonviolent offenders with substance abuse issues. I do a lot of premarital counseling and couples counseling, family counseling, I work with adolescents in terms of adjustment kinds of issues. And in order to develop my skill set as a mental health treatment professional, I've worked at UK's Counseling and Testing Center. I've worked in the Counseling Psychology Clinic when there was a clinic. I also worked at the Kentucky State Reformatory. It's Kentucky's prison setting, which is in LaGrange, Kentucky. And while working there, I worked in the clinical treatment unit for Kentucky inmates that were most mentally impaired. And then I also worked in the Federal Medical Center with both males and females, primarily males, but also with females at the Federal Medical Center. And the Federal Medical Center is actually a federal prison here in Lexington. And so while working there, I worked in the residential drug abuse program. I also worked as a unit psychologist, and I did various forms of forensic assessments with inmates, some of whom were awaiting trial and some of whom were in correctional settings. So in a nutshell, that tells you a little bit about who I am as a clinician. I love therapy. I love working with persons with mental illnesses or persons with adjustment issues. I am a product of counseling, and so I believe in the power of therapy. I know the changes that can come about not only from my own personal experiences with therapy, but also based upon some of the work that I've done with people with different kinds of mental illnesses and adjustment issues. I have a specialty area in working with persons that are survivors of childhood sexual abuse, both males and females, and I find the work that I do very rewarding. I never take it lightly when I have clients that are willing to share some of the most personal and private moments of their lives. And so it's from that point of view that I take my work very seriously. And I also take the responsibility of educating students regarding mental health, diagnosis, and treatment very seriously. So that's who I am in terms of my clinical skills. As a researcher, I provide research on HIV, STD, and pregnancy prevention. Have worked for many years, since the early 90s, in HIV prevention. And I am developing a new area of interest that has to do with caregivers of persons with Alzheimer's disease, because I recognize that caregivers have a lot of stress and burden when taking care of loved ones. And so that's who I am as it relates to a researcher. And personally, I'm married to a wonderful husband of nearly 19 years who works at UK's grad school, Cleo Price. And we have two beautiful daughters, Gabrielle, who is now 15, and Hannah, who is 13. So I live a very, very full and rich life between work life, professional life, and my responsibilities here at UK, as well as the private practice work that I do. So that's who I am. I'd like to now introduce you to Amani, who is my teaching assistant for this course. Amani is a doctoral student in our doctoral rehabilitation counseling program, and I met her in 2008 when she first applied for our master's program, and I had her in many of the core courses. She always has had a commitment to working with persons with mental illness. And so she and I had lots of conversations, as well as Amani has done various research papers exploring issues related to mental illness. She also brings with her a wealth of experience from a global perspective, because she's originally from Jordan and she understands issues related to mental illness, not just as it relates to this country, but as well as global issues related to mental illness. So in 2010, Amani completed her Master's in Rehabilitation Counseling and also completed her certification as a nationally certified rehabilitation counselor. She has an undergraduate degree in psychology, counseling, and mental health from University of Jordan. She has worked as a school counselor for 5 years, and for the last 2 years, she has worked as a part-time counselor in a hospital for persons with mental illness, and she is currently working as a volunteer in schools, and she leads behavioral modification workshops and public education on topics related to managing behaviors. On a personal note, Amani has 4 beautiful children, and she's married. So Amani wants you to know that she is here to help you if ever you have any questions or any needs. So please do not hesitate to contact Amani should any question or need arises. And so here is Amani's email address. I too am available to assist if ever the need arises. And so don't hesitate to contact either Amani and or myself should you have any questions. And as we have been developing this course, we definitely do it with what is in the best interest of you, the student. So in proceeding, I'd like to just kind of talk with you a little bit about the competencies of what it takes to be a mental health counselor. And then after I talk about the competencies in the 10 core areas, I'll introduce to you 3 of the additional guest speakers that will be participating in this course, tell you a little bit about them, and then I will proceed with discussing in detail our course syllabus and some of the core requirements. So when research has been done that has asked therapists as well as administrators what is most important as it relates to counselors. Because if you just think about being a mental health worker, be it here in the United States or various other countries around the world, one of the most universal expectations and core requirements is competence. This is an area that while theoretical frameworks might differ, while some of the best ways of providing services might be different, all therapists universally agree that it's important as counselors that you are competent to meet the needs of those that you provide services to. And in order to do so, credentialing and accrediting bodies as well as mental health counselors have identified specific areas where knowledge for mental health counselors is required. And so they've come up with 10 core areas specific to the provision of services and where competence is needed for mental health counselors. And so what I'd like to do is provide you with an overview of the 10 competence areas, and then the core area that is specific to mental health diagnosis and treatment. I'd like to spend a little bit more time on it. So irrespective of whether it's practitioners, educators, counselors from various settings, everyone agree that it's important that counselors have expertise and a competence base in 10 core areas. For starters, the first core area is professional orientation. So having an orientation and an understanding of the services that are provided for persons with mental health issues. The second core area has to do with social and cultural foundations, because we recognize that it's really difficult for you to have a full understanding of a person with mental health issues without taking into consideration the cultural and social context from which they come. The core area 3 speaks to human growth and development. You have to understand like Erikson's developmental stages as well as Piaget and Freud. So in understanding humans and behaviors. People behave in ways that are consistent with developmental stages. And so it's important in core area 3 that you have a really good grasp and understanding of human growth and development. The 4th area deals with lifestyle and career development. And so that's where the career counseling and lifestyle counseling comes in. Core area 5 deals with counseling theory and helping relationships. And it's really important that in order to be a competent, qualified mental health counselor, you have to understand theory. So, for example, in our program, the graduate program in rehabilitation counseling, students are required to have theories and techniques of counseling 1 and theories and techniques of counseling 2. We also have group therapy and family therapy, and of course group and family therapy are all within one course, but all of these courses speak to the relevance and importance of theoretical frameworks by which we understand working with clients and helping them in a therapeutic context. What I will say is for this class, and this is also stated in your syllabus, although there are no prerequisites stated for this course, it will be most important that you have an understanding of theories, counseling theories that are used to help persons with various forms of mental issues and mental illnesses, because without a theoretical framework, you'll find it really difficult in order to understand some of what we're talking about. Not impossible, but difficult, and you'll have to fill in that knowledge base as you're matriculating through this course. In terms of the 6th core area, it involves group counseling, and so I've already mentioned that we have a class that involves group counseling, because what we know is that there's a lot of benefit from group therapy. We also know that with managed care, usually persons are limited to 6 to 8 sessions, and their issues may exceed that minimal number of services. But when people are able to benefit from a therapeutic context through group counseling, they can receive services for a much longer period of time, and it's most cost effective. I also know myself from working in therapeutic settings that when there are other persons in groups, clients learn a lot from each other. So rather than learning directly from the therapist, they're also learning from each other, particularly when it's a trusting, cohesive environment. With regard to core area 7, assessment and appraisal, that would be the Voc-Eval course, and it's important because sometimes we have to provide various forms of assessment by which to best understand our client, particularly with regard to their diagnosis and in order to formulate the best form of treatment. So assessment and diagnosis is really important. And core area 8 speaks to research and program evaluation, because despite the great work that we think we're doing, it's only when we're able to evaluate its effectiveness that we really know if we're having an impact. And research helps to guide our practice. It helps to make sure that we're using evidence-based practices that are empirically validated and supported so that we can meet the needs of persons with mental illness, and also that we can use those types of techniques that have been proven to be most effective. So research and program evaluation is another important course that students are required to take. And core area 9 focuses on diagnosis and psychopathology, because in order to be a proficient clinician, not only must you be able to recognize some of the terms and what they mean, but sometimes as a mental health treatment professional, you are called upon to be a qualified mental health practitioner, a QMP, or sometimes they called a QMR, qualified mental health contributor, professional, but you have to have a knowledge base in diagnosis and treatment in order to meet the needs of persons with mental illness. So you understand what the diagnosis is, some of the criteria associated with it, not only in terms of its pathology, but also in terms of the skills and abilities that one might have despite their limitations. So Core Area 9 really speaks to our course, and it has to do with the diagnosis and psychopathology of working with persons with mental illness. So without this area, without this knowledge base, you will not be competent to meet the needs of persons with mental illness. And last but not least is psychotherapy. It's expected that you have practical skills that allows you to provide treatment to persons with mental illness. And oftentimes a lot of that therapeutic experience comes in when you're working in your practicum and internship site at various treatment facilities. I know some students will be doing their practicum at Eastern State Hospital, as well as some may do internships at Eastern State Hospital, but it allows students to put to practice some of the skills and techniques that they've used. So just to unpack the diagnosis and psychopathology relating to Core Area 9, it ensures that there is an understanding and ability to recognize the differences between normal and pathological personality dynamics and functioning. So, if you look at a person's behavior, you're always asking yourself, where does this behavior fall on the continuum between normal and abnormal? And so whenever behavior falls in the spectrum of abnormal in terms of functioning or pathological in terms of functioning, that's where mental health clinicians intervene and provide treatment to minimize or help persons to overcome whatever their mental illnesses are. Another area or another issue that is specific to Core Area 9 has to do with providing a sound knowledge of the current edition of the DSM. We know that the DSM-4 TR was revised in 2000, and next year we will have the DSM-5. So next year's course will have the revisions to the DSM. But for now, we're focusing on the current edition, which is the DSM-4 TR that was published in 2000. And part of what we will do in this class is to make sure that you have a good working knowledge of the current edition of the DSM, and that you also have the ability to use the DSM to make an accurate multi-axis assessment. So you use your DSM in order to identify what the axis 1, 2, 3, 4, or 5 diagnosis is. And based upon the diagnosis, then you move on into assessment and treatment. And lastly, there is the ability to conduct psychosocial histories, so understanding the history of the individual, also the intake interview, which is really important for information gathering, and it begins the relationship development, and also the mental status examination to facilitate diagnosis and treatment planning. And so within your notes or within the lecture will be information specific to the mental status examination in an effort to facilitate diagnosis and treatment planning. So I have a certain knowledge base, as you know, by some of the information that I've shared with you, but I don't begin to assume or purport that I know all there is to know about mental health issues. I see myself to be a lifelong learner, but I also recognize that there are people with far greater knowledge than myself, because we all bring certain expertise to the table, which is why we have a lot of treatment teams, because rarely does one ever work in isolation. So from that perspective, for this course, we have Dr. Todd Sheaver, who is an associate professor of psychiatry here at the UK College of Medicine. And Dr. Cheever was among the guest speakers that I would sometime have many, many years ago when I taught medical and psychosocial aspects of disabilities, and I would cover a particular unit on mental illnesses. And Dr. Cheever, way back probably almost 10 years ago, was among the guest speakers that was readily available to come in and share his expertise. And so he's within the Department of Psychiatry, where he serves as the clerkship director and as the associate residency training director. He's also the course director for the second-year psychiatry courses. And within the College of Medicine, he's the Associate Dean of Student Affairs, where he's been in this position for 7 years. And his areas of interest include medical student and resident education, community suicide prevention education, the Kentucky Psychiatric Medical Association, and psychiatry in cinema, which I find very interesting. I always enjoy watching movies that has something specific to psychiatry, like Silence of the Lamb. So Dr. Cheever is, he was very supportive and eager to put a pause on his very busy schedule and share his expertise for this course. And so I'm sure you will find his lectures to be very benefiting as you learn about various areas of mental illnesses. The next speaker that I'd like to introduce to you is Dr. Scott Haas. And Dr. Haas will speak on he'll speak on psychopharmacology. And so if I could just back up, if you don't mind, I'd like to just back up and share with you that Dr. Cheever will provide relevant information on mood disorders, psychotic disorders, personality disorders, and anxiety disorders. And so he will provide a lot of invaluable information on those mental health diagnoses. You'll also find that both myself and Amani have provided lectures as well. So here are some additional experts that we have. And so with Dr. Haas, he's a psychiatrist and the chief medical officer at Eastern State Hospital, which is a state-funded mental health treatment facility, one of the best in not only in the state but in our region and in the country. They're doing a lot of innovative types of things. And so Dr. Haas, as busy as he is with all the hats that he wears, he too took time out of his busy schedule to come and record lectures on psychopharmacology, because they believe in giving back to the profession. They believe in helping to expand the knowledge base of mental health treatment providers that are up and coming in the field. So I just can't say enough about the wonderful people who have taken the time to help to expand your knowledge base for this course, because it's so easy to say, no, I'm busy, go to someone else. But with the people that I'm introducing you to, all of them, you know, the first time I contacted them, they said, yes, I'd be happy to. So that says a whole lot. So with Dr. Haas, he has the awesome responsibility for overseeing medical and psychiatric services across the full continuum of care. So not only does he oversee care in as it relates to psychiatric treatment, but also medical treatment as well. So that's pretty impressive and expansive. And so Dr. Haas previously served as the chief of psychiatric services and then as the medical director for the Kentucky Department of Corrections, with responsibility for facilities across the entire state. So I don't know this for certain, but I wouldn't at all be surprised if Dr. Haas was among the mental health professionals that developed the clinical psychiatric treatment facility in LaGrange, Kentucky at the Kentucky State Reformatory. Because there was a time in the not so distant past when inmates in state facilities were not properly treated. They didn't have the necessary treatment facilities. And so I wouldn't at all be surprised to learn that Dr. Haas was among the practitioners who ensured that the state inmates received appropriate forms of mental health treatment. So Dr. Haas has managed care experience, helping worked for several years as a utilization review consultant. He has a reputation for promoting high quality care within environments where costs are contained. And so oftentimes everything that drives treatment has to do with managed care, wanting to make sure that people are receiving fewer sessions but getting the highest quality of care. So whenever you have someone like Dr. Haas that's in a position to make sure that while they're trying to contain costs through managed care, the ultimate goal is to make sure that people receive the optimal form of treatment. So hats off to Dr. Haas for the wonderful work that he's doing, and much appreciation for him taking time to come and record the lectures that you'll be privileged to have in this course. The next speaker I'd like to introduce to you is Dr. David Sussman. And Dr. Sussman is a licensed clinical psychologist and director of the award-winning Recovery Mall program at Eastern State Hospital here in Lexington, Kentucky. And so Dr. Sussman works with Dr. Haas. In fact, Dr. Haas is the supervisor. You know, he's over all psychiatric and medical services. So Dr. Sussman works underneath Dr. Haas. But he also serves as psychology services coordinator for the hospital. And he is a clinical associate professor in psychology at UK. And he is director of UK's Harris Psychological Services Center. He has provided recovery and rehabilitation services to adults with serious mental illnesses and substance abuse issues for well over 20 years. And he has been an active mental health advocacy and he has been active in mental health advocacy initiatives at the state and federal levels. One of the things that I know about Dr. Haas is how serious he takes the learning of students. He serves as a facility site supervisor for some of our students with interests in expanding their knowledge base in mental health treatment provisions for persons with mental illness. And I know that Dr. Haas is very committed to the learning of students, and I know this because he goes above and beyond the call of duty to help students get placed, and not only get placed at their facility, but also get the knowledge base that they need. And also he assists them with obtaining employment once they've graduated. So I can't say enough wonderful things about Dr. Haas. He has been such a wonderful colleague to work with, particularly for me as I have attempted to find ways of expanding the knowledge base of our students who have interests in working with persons with mental illness. So Dr. Sussman is always available and eager to assist. And he was in this instance when I called upon him to do a lecture where he gives a lot of invaluable detail on the Recovery Mall, which is, like he stated, an award-winning program. They didn't have to implement this particular program, but they did. And because of it, students get the benefit from learning from all the wonderful work that they're doing. And so within the class, you'll learn about the Recovery Mall and how beneficial it is to persons with mental illness. So what I'd like to do from this point is to review the course syllabus, and I would encourage you to obtain a copy of your syllabus in hand as I review the syllabus and some of the core expectations for the class. So I talked already about the fact that there are no prerequisites for the course. It's open to not only students in rehabilitation counseling, but also students that are in other mental health and social service professions, including various areas of psychology and social work. So while there are no prerequisites for this course, without a background in theories and techniques of counseling, you will find that this class will be a major stretch for you, because theories and techniques are needed as we look at the treatment modalities that are most effective for persons with mental illness. Because once you've diagnosed the illness, or you've assessed it and you've diagnosed it, the next part of it is treatment. And the various theoretical frameworks are what is used to provide adequate treatment for persons with mental illness. So that is why a background in theories and techniques of counseling is very important. So for our class, the two books that are required is the first by Peterson, which is called Psychological Aspects of Functioning, Disability, and Health, as well as the American Psychiatric Association's DSM-4-TR. So just to tell you a little bit about the first textbook, I see it as a very comprehensive text, in that not only is there a wealth of information about the DSM, it also has information on the International Classification of Functioning, because this way of assessing a person's functional abilities is really, really important. It's a global model that is really expanding its utility within the United States. And I think for you to be cutting edge, not only is it important that you understand the DSM, but it's equally important that you understand the International Classification of Functioning. And in so doing, I selected a textbook that gives a lot of detail and attention to the International Classification of Functioning, as well as the DSM. And so you'll find content specific to both in the text. The DSM is really important because you have to have a familiarity with that multi-axis system of diagnosis. That is essential. And if you want to be a provider of mental health services in this country, you have to be familiar with the DSM. And so from that vantage point, that is the second required text for the book, for the class. And then as a recommended text, it's a very little small book that is used as a pocket guide. It's by Zimmerman. It was published in 1994. It's called The Interview Guide for Evaluating DSM-4 Psychiatric Disorders and the Mental Status Examination. It's a very inexpensive little book. But what I love about it is it's so little it could fit in your pants pocket, your dress pocket, or in your purse, because there are times as mental health professionals that we need something quick and easy to access. You'll find that the DSM is about 1.5 inches thick, and you don't want to always carry it around. But if you have that little small interview guide, it gives you a wealth of information that you'll need. The other thing that I found as a practitioner is having a phone that allows me to have quick access to all sorts of information. Like, for example, when I'm working with some of the nonviolent offenders with substance abuse issues, and they're talking about all these different kinds of addictions and pill addictions, it's so easy for me to type it into my phone and do a quick search. And then I also bookmark a lot of relevant information. So Make sure that as you become more proficient in mental health treatment provisions, that you have these quick, accessible guides at either your fingertips or within your phone. That's always user-friendly. For me, in this course, you know, the books that we have are excellent, but because of the importance of making sure you have certain information, I've also pulled from other sources. So for me, as I prepared for the course, I wanted to make sure that I give you a gestalt of what I believe to be the most relevant, much of which is in your textbook and also in the DSM, but then I pulled from other sources as well. So, and those other sources, you know, you'll have the benefit of the information without having to worry about making any purchases. So I can go into the course description, but I'm not, because I think thus far I've given you a wealth of information about what this course is about, the primary areas that we're focusing on, whether it be inpatient treatment settings or outpatient mental health treatment settings. We will be focusing on various forms of mental illnesses, and looking at diagnosis, assessment, treatment, and providing services. So really, really important for me is that students have a really good grasp of how to conceptualize various forms of mental illness, how to understand various forms of assessments that are used and why they're used, exploring treatment modalities for various forms of mental illnesses or mental disorders. And then I also touch on report writing, because I remember students that took the CRC years ago talked about the SOAP model for note writing and documenting. And so SOAP stands for subjective, objective, assessment, and plan. And of course, you'll get into more of that as we get into the course. But I wanted to make sure you had an understanding of report writing and documentation, and also follow-up, because once we provide treatment, we don't just forget about our clients. We also follow them up to make sure that they're doing well, and if they're needing additional services, while their insurance may not provide it, we work to connect them with the requisite services within the community. So that information is provided, and because we are fortunate to have Amani as a co-teacher in this course, a teaching assistant in this course, I thought it would be really beneficial for us to have an opportunity to learn about mental illnesses and mental health treatment issues, not only from a national perspective with regard to what's happening in the United States, but also to learn from a global perspective or an international perspective. And so in addition to understanding all of the above, we will explore mental health treatment issues as it relates to a national and global perspective. So basically, the objectives for the course is to ensure an understanding of the International Classification of Functioning Disability and Health, simply known as the ICF model, understanding the DSM-4TR, because in many treatment facilities, that is like your golden rule book, knowledge of various forms of mental disorders. So, for example, specific to this course, we'll talk about anxiety, mood, psychotic, phobic, adjustment, and personality disorders. You know, I recognize that there are many, many more. For example, there are various kinds of substance abuse problems, but I also know that in this limited time, I can only cover so much information. And so I know that it's most important that you understand anxiety disorders, mood disorders, psychotic disorders, some phobic kinds of issues, adjustment, and personality disorders, because those are some of the major mental health issues that you'll be confronted with. And I also know that within the rehabilitation counseling program, there is a substance abuse course. So I didn't include that particular area in our lecture, but I will encourage you to work with that course, to take the course, Substance Abuse and Chemical Dependency. And one of the things I have found as I work in private practice is that the pill epidemic is really sweeping our country. The addiction of persons with various kinds of painkillers and anxiety medications is just really, really sweeping our country. So I encourage you to take the Substance Abuse and Chemical Dependency course, because that's another course that you will find a lot of benefit as you continue to work in the area of mental health counseling services. Also, there is an ability to make sure that students have an understanding of psychopharmacology, which is the expertise that Dr. Haas brings to us, as well as psychosocial treatment modalities, and that is what Dr. Sussman will present to us. And he will primarily share this information through the recovery mall paradigm, where not only does he work with persons with mental illnesses, but with their families as well. So we will definitely cover psychopharmacology and psychosocial treatment modalities for persons with mental illnesses. The ability to thoroughly gather and extract client information from a variety of sources, for example, the clinical interview and the case review. So we have assignments that I'll be talking with you about a little bit later that allows you to develop your skills in those areas. Because for me, I believe that your knowledge is developed and expanded through practical exercises, not so much through tests, but having the opportunity to research, conceptualize, and write reports as though you were functioning as a clinician. So I have assignments where that is required. There is also the ability to write clinical summaries and render multi-axis diagnoses, and that's consistent with the clinical analysis and the case review that will be discussed in your assignments. And finally, the demonstration and awareness, to demonstrate an awareness of the presentation and treatment of psychological disorders from a cultural and international perspective. You know, we recognize that we cannot understand our clients unless we look at them holistically. And when you look at a client holistically, you have to look at the micro as well as macro kinds of issues. Micro issues might include the family, might include the school, but the macro issues include the community, the government, and other kinds of systemic issues that impact on individuals. So we recognize that it's important to understand our clients from a cultural as well as international perspective. So as it relates to the course requirements, there will be discussion boards within the course, and there may be, in some weeks there may not be any discussion boards. I know the very first week there will be a discussion board pertaining to this video that you will be watching, this web-based video, Erasing the Stigma of Mental Illness. So I know with week 1 there will be 2 discussion boards that you will have to participate in as it relates to Erasing the Stigma of Mental Illness and something pertaining to the International Classification System. And you'll find other weeks where there are no discussion boards, but it's important that you take the time to give well thought out, substantive comments, not just write something for the purpose of getting the assignment done, but that you take the opportunity to really be reflective and provide thorough, substantive, thought-provoking comments to the discussion board. I know that for this class that the way it's structured, students can get a lot out of it, particularly if you put a lot into it. So if you're willing to roll your sleeves up, work hard, and work through all of the assignments, pay careful attention to all the lectures, I know that you will have a plethora of information to take with you. And I also know that the way the class is set up, some students can get by without having to listen to all of the lectures. But I just want to say that if you put the time into it, I guarantee that you will reap multiple benefits throughout your career. So that's my little spiel and my plea to encourage you to maximize your learning potential through this course. The second assignment, or the B assignment or requirement for this course, is a mental health terms and definitions quiz uploaded for your information for week 1 is a handout that includes mental health terms and definitions. And it's important that you take time, sit with these terms, some of which are redundant. When you print out the information, you'll notice that, especially in the back, some of the terms are repeated. So, whenever you see repeated terms, just think, hey, that's an opportunity to reinforce your learning. But in order to really communicate with other professionals, you need to know the lingo. You need to understand the terms and be able to operationalize them. And so from that point of view, I thought it would be necessary that you are presented with these terms and definitions, but then that you get a quiz that allows you to show your expertise on what you've learned. So you will have a quiz with 25 multiple choice questions that will be made available to you during the first week of the course, and students are able to, you must have the quiz completed by the end of week 1. But for the 25 questions, you have 45 minutes to complete the test. Students that might have students that have accommodations through the Disability Resource Center will have additional time, but you're required to complete the quiz independently. You may not use your notes, your handouts, or any other resources during the quiz. This is really to force you to take the time needed to familiarize yourself with the terms, and then to show your knowledge through the quizzes. So if students work collaboratively or use notes or anything of that sort, and I become aware of that, then it will result in a 0 on the quiz. So I just want to encourage you to take the time, learn the terms, because you'll find that later on, when you're speaking with other clinicians and they're using some of these terms, you'll be able to communicate on the same level because you are privy to exactly what they're speaking about. So this quiz will occur during the first week of the class, and you'll have up until the end of week 1 to complete the quiz. Okay, so the subsequent assignment has to do with getting to better understand and become acquainted with the DSM and the ICF. And so in an effort to do this, which is due during week 2, you are to select a particular topic that's of interest to you. So you look through your DSM. identify a particular diagnosis that is of interest to you. I want you to use the DSM to obtain the necessary criteria and classification. Not only understand this diagnosis from the DSM, but also understand it from the perspective of the International Classification of Functioning, because that way it allows you to use both resource tools. But additionally, I want you to draw in scholarly literature. So I want you to do a scholarly literature review to identify relevant information regarding the topic of choosing. And so once you've done that, and you've thoroughly reviewed and researched this diagnosis using the resources indicated, I want you to identify relevant information, talk about the relevance, the importance of the diagnosis, key issues related to the diagnostic criteria and the functional abilities, and then you conclude your paper by discussing what you learned from this assignment and its relevance to your work and your chosen profession. So this is an opportunity for you to identify an area that you're interested in, delve into the DSM, as well as explore its relevance from the ICF, and find any key information as it relates to the literature. Because every diagnosis that you will find in the DSM, it's in there because of its relevance that was born out of the literature. And so it just didn't happen to appear in the DSM. It's in the DSM because there was compelling information in the literature that spoke to its relevance. And from the relevance that was born out of the literature, it became a diagnostic criteria in the DSM. And so I want you to use the literature to help inform why it's such an important topic, why mental health practitioners deemed that topic of such import that they included it in the DSM. And then how does it relate to the ICF model? How does the ICF model help to understand the functional abilities of someone with that particular mental diagnosis? And so your papers are to be 5 to 7 pages in length, double spaced, not including the cover page or the references. And so basically that's what the expectation is for this assignment, so that you could have a personalized learning experience as a result of this assignment, to expand your knowledge base in an area that's really important to you. So this assignment is due by the end of week 2, which is May 21st. And the reason I say by the end of week 2 is because I recognize that we have some people that'll get the assignment done sooner. Some people might be submitting it at 11:58 p.m. on the night of May 21st. But for persons who'd like to submit it early, that's great. I just want to caution those that may submit it later that in situations like that, something inevitably goes wrong. So give yourself a little bit of time and try to avoid submitting at 11:58 p.m. on May 21st. The next assignment is the clinical analysis. And so students will complete a multi-axis diagnosis of a person presented in one of 5 case studies that will be available to you on Blackboard. The case studies that students will complete will be based on the first initial of their last name. And this is just to help ensure that everybody isn't doing the same case study, but there are multiple opportunities for various case studies among the students in the course. And the assignment is designed to facilitate your understanding of and familiarity with the DSM multi-axle system. So you have this case study that you will identify based upon the first initial of your last name, and so then you will have to complete this clinical analysis, taking into consideration all of the 7 points that is outlined in your section D under the clinical analysis section. And so just to go over the clinical analysis section, so for the case study, the first question you'll have to answer is the demographic information. And what I would like for you to do is use headings. I'd like for you to use the headings that I have here. These are the exact same headings that you would use in a professional setting when you are working with clients. And so for the purpose of this assignment, it is expected that you use the same headings, and within the headings there's the relevant information that would be included. So for example, number 1 is demographic information, and so you would include the name, the age, the gender, ethnicity, and other demographic kinds of information. For example, the location, education level, you might include socioeconomic level, but any demographic or identifying information of this client you would want to include under demographics. With regard to the presenting concerns, we know that whenever a client comes in, they come in because there is a problem. So they present saying to you that I am here because. And so whatever the because is, that involves the presenting concern. And so you are to give a description of the presenting problem, the onset, the severity, the duration. I'd like for you to talk about what makes it, what lessens the severity, what makes it worse. Every client I've ever seen, there's always a straw that breaks the camel's back. You know, issues may have been going on for an extended period of time, and all of a sudden, one day, there's that straw that broke the camel's back that facilitated the client coming in. And so you definitely want to include all of this information under the presenting concern as it relates to the case study that's assigned to you. Number 3 is behavioral observations and mental status. So you want to talk about the affect or emotions, the mood that the person presents with, whether there are body jitters, kinds of behavioral patterns, suicidal or homicidal thinking, insight. So anything that you would observe as it relates to the client's behavior and their mental status, you would include under this particular heading, the heading behavioral observations and mental status. The fourth area under the clinical assessment would be relevant background information. So the social history, abuse history, family history, vocational kinds of issues, mental history, like if they've ever been treated for a mental illness, and any other relevant kinds of information. Number 5 is the theoretical conceptualization. And see, this is where having that background in theories and techniques of counseling is really important, because let's say however you work with this client, it has to be based on some kind of theoretical framework. So for example, if you're into cognitive behavioral therapy or rational emotive behavioral therapy, you're looking at affect, cognitions, and behaviors. And so you're identifying whatever the problems are from the theoretical framework that aligns closest with who you are and the work that you like to do, as well as cultural considerations. So presenting problems and the cultural considerations. So you want to take those two into consideration as you're working with the theoretical conceptualization. Number 6 is the multi-axle diagnosis, and that includes rule-outs or provisional diagnoses. And so if you have a client with a particular mental illness, You go into the DSM, you look at the various categories, you identify which of the categories that are most relevant to the client to determine whether they fit the multi-axis diagnosis. And so you are to give the client a diagnosis based upon the information presented to you. I recognize that in doing this assignment, you may not have all of the multi-axis diagnostic information just right, but that is okay. What is most important here is that you take the time and go through the assignment and think critically about what information is presented to you and what the diagnosis is. And then from there, what are some of the treatment goals that you would incorporate based upon your theoretical conceptualization. So if for example, your theoretical framework that governs how you would intervene with this client has to do with rational emotive behavioral therapy, then you know that you would have to work on some of the cognitions to get the client to change what they're thinking. If you change the thought processes, then oftentimes it changes how a client feels. And then from there, it also impacts their behavior. So you might want to give them some behavioral homework. So think about the treatment goals and the proposed interventions consistent with the theoretical conceptualization that will be used. Okay, and so the final assignment, which is one that I'm most excited about, has to do with the classic case project. It's worth 30 points. It's symbolic to your final assignment for the course, and it's due on June 4th. And in fact, when I was a student many moons ago, I had to do this exact same assignment, and I just remembered loving it, and I thought it was such an awesome learning opportunity, not only as it relates to learning about somebody in the public eye, but also it allowed me to put into practice how I would work with someone that I've often read about or heard about through the popular news media. So for this classic case project, it includes writing a brief clinical interview of a well-known person as if the person were your client. The person does not have to be living. The person can be deceased. However, for the purpose of this assignment, you're going to be working as though this person is your client in a therapeutic context. This person may be from television, literature, history, or any other source. And the written psychological assessment must include information that is required for the minor clinical write-up. So the same clinical analysis for write-up that you have above is the same that you would utilize for this classic case report. And so your paper will be 10 pages, double-spaced, well-written. Please know it's important that your papers are well-written with minimal, if any, errors, because errors will result in a reduction of your score. So you write up your report, making sure that you use the headers that are outlined above, which is very important. And so I have an example of a list of different popularly known persons that you can write about. But please know you are free to select someone of your choosing. And so I have people from Howard Stern, Tyler Perry, Harrison Ford, Mike Tyson, you name the names. I tried to think about it, and I've included them, from the person who did the Virginia Tech University shooting to the DC bomber, the Unabomber, you name the person, and you would include them as your client. So what's important here is that you research the person. We have so much information on the web. So much is at our fingertips. And so it's really important that as you work on this assignment, you have to make sure that you select someone that there's a lot of information about. You cannot select someone that there is very minimal information known about them, because how else would you be able to conceptualize who they are or write up the demographic information, the presenting problem, and going through all of the various areas of the clinical write-up. So you want to make sure that you choose someone that has a reasonable amount of information written about them. Okay, so once you have completed that assignment, you write it up within the 10 pages. You must submit the assignment by June 4th, which is the end of week 4. Feel free to submit it earlier. However, June 4th is the deadline by 11:59 p.m. So basically, that is consistent with the final examination. That clinical case write-up is consistent with your final exam. That is, for all practical purposes, the final exam for your course. And so it's my opinion that these assignments provide you with an opportunity to put into practice some of the things that are most germane for practitioners in the field of working with persons with mental illnesses. You can listen to lectures all day long, but unless you have a case study that you're forced to think critically about, conceptualize, think about the diagnosis, the treatment, the different forms of interventions that you would use, it's really, really hard to know what you know until you're forced to do that. So I gave you assignments to help you to move in that direction. So this is a graduate level course, a 500 level course, and so it's ABCE. If there are any advanced undergraduate students, then they definitely would have the option of getting the D grade. However, graduate level students do not have that option. I want to reiterate or iterate the importance of turning your assignments in on time, uploading your assignments on time, and late assignments will be assessed a penalty of 5 points each day. And because this is a 4-week course and things are moving rather quickly, it's very, very important that you stay on top of your assignments, that you get them done in a timely manner, because otherwise you can quickly and easily get behind. So I want to encourage you to stay on top of things. Any student that has registered with the Disability Resource Center will receive accommodations that are consistent with the stated requests or recommendations from the Disability Resource Center. I will be happy to assist you so that you can be successful in the course. So whatever the accommodations are as specified by the Disability Resource Center, I am very happy to accommodate. Academic honesty is really important. In this class, it's all about you expanding your knowledge base. So I really, really want to emphasize the importance of working on these assignments in ways that will foster your growth and development and expand your knowledge base so that you will feel very proficient and confident as a treatment provider for persons with mental illness. So I'd like to move forward with looking at our schedule, our class schedule for the remainder, for the 4 weeks of our class. And so week 1, which begins May 8th and it ends on May 14th. So I'd like to start off with this class with a videotape called Erasing the Stigma of Mental Illness. You will find it at the link provided in this handout, or there will be links in on on Blackboard. In various places you'll find it. But what I love about this this presentation, it's called Health 360. It was done here in Lexington, and it involves mental health clinicians throughout the state of Kentucky. In fact, Dr. Sussman is among the experts, but also it has persons that are living with mental illness as well as their family members and how families cope. And so it's presented from the issues related to the stigma associated with having mental illness, the treatment issues that are most important, persons living with mental illness as well as family members, issues related to advocacy and the importance of funding to make sure services are available. So I want to start the class off with requiring that students look at the video, Erasing the Stigma of Mental Illness, because I thought that it provides a wonderful opportunity for you to get a really good conceptual understanding of mental illness and all of the intricacies that go into it, not only from the person with mental illness, but treatment providers, family members, and the broader society. In addition to that, I'd like for you to have an overview of the International Classification of Functioning, Legal and Ethical Issues in Clinical Practice, and that will include chapters 1 through 4 of the Peterson textbook. And so that information will be, all of which will be required for week 1. And so pay particular attention to the fact that the quiz specific to the mental health terms and definitions will be due no later than May 14th, which is the end of week 14 of week 1, May 14th, and 25 multiple choice questions. You have 45 minutes with more time allotted to students with accommodations recommended through the Disability Resource Center. So moving on to week 2, we kind of get into the DSM. So there's an introduction and overview of the DSM. It takes into consideration the history of the DSM and some of the changes that have occurred through the years. There's also a presentation on mental health assessment, diagnosis, and treatment planning, and there will be part one of that presentation. And so the 2 core areas for week 2 is a review of the DSM from history to an introduction of the DSM. And then there's a lecture on assessment, diagnosis, and treatment planning, the part 1 of the lecture. So the assignment that focuses on getting better acquainted with the DSM and the ICF will be due no later than May 21st at 11:59 p.m. And in terms of your reading, you would benefit from reading chapters 5 and 6 of the Peterson textbook, as well as paying close attention to the DSM TR. The DSM will be really helpful as you unpack and understand the DSM and how it's used. And subsequent to that, we will have the second part of the presentation on assessment, diagnosis, and treatment. And it looks a lot at the different frameworks that are used to understand the client, issues related to treatment planning, interventions that are used. And of course, we don't go a lot into interventions because it's the assumption that you've had theories and techniques, but it gets into some of the interventions that's used and why they're used with various kinds of treatment issues. There's information specific to evaluations, report writing, and follow-up, providing follow-up services to persons with disabilities, mental disabilities. There's also presentations from Dr. Cheever that reviews some of the psychological disorders, whether it be affective, psychotic, mood disorders, as well as personality disorders. So we'll have Dr. Cheever during week 3. And then you have the clinical analysis that is due. That assignment is due by the end of week 3, no later than May 28th. And in week 4, you have lectures by Drs. Haas as well as Dr. Sussman. And so Dr. Sussman and Dr. Haas will provide lectures on the different kinds of treatment modalities. Dr. Haas will highlight information specific to psychopharmacology, and Dr. Sussman will provide information on psychosocial treatment modalities. He'll talk in detail about the recovery model and the ways in which service provisions are made. There's some mention of NAMI, which is the National Association for Persons with Mental Illness. It's a resource that exists in every state in the United States for working with persons with mental illness. So your classic case project is also due by the end of week 4, no later than June 4th at 11:59 p.m. So I've provided you with an overview of the weekly schedule. And if you have any questions or comments or concerns about anything, please do not hesitate to email either Amani or myself. We will be happy to assist you. We are delighted that you have selected this course to expand your knowledge base. We've given a lot of time and effort to thinking about what would be most beneficial to you. And based upon my own knowledge base, I believe that this will be an invaluable learning experience that will be very enriching to you as you continue your area of practice, either as a mental health treatment provider or as an important part of a treatment team where services are provided to persons with mental illness. So thank you so much for your attention, and I'm happy to have you as a part of this learning experience. Take care.